Good afternoon and welcome to the COVID-19 update on Channels Television. I am Kayode Okikelu. Here are some of the highlights. Nasarawa State Governor warns members of the steering committee to ensure that food items get to the grassroots, insisting that only the poor should benefit. Our focus this afternoon is on Nigeria's journey to developing a vaccine, and we'll be speaking with the DG of Nigeria's Pharmaceutical Research Institute, NIPRID. And on the foreign scene, Kenya indicates interest in Russia's vaccine for treatment of its citizens, as the WHO insists that all vaccine development must follow due process. Thank you for joining us this afternoon. We begin with news just in. Nigeria's Foreign Affairs Minister Geoffrey Onyema has recovered from COVID-19. This is coming weeks after testing positive to the virus on July the 19th. The minister, who announced this on his Twitter handle today, says he spent 3 weeks in isolation. The tweet reads, "By the very special grace of God, my latest COVID-19 test result came back negative after 3 weeks isolation. I am eternally grateful to my family, the CNC, the VP, the medical team, relations, friends, colleagues, religious leaders, and numerous well-wishers who, through their care, prayers, fasting, messages of support and encouragement, never let me walk alone." The minister, who has already resumed duties, was welcomed to a resounding cheer by staff of his ministry. Well, it's not just the Minister of Foreign Affairs that received a clean bill of health. A total of 263 COVID-19 patients have been discharged in the last 24 hours, while 6 lost their lives to the deadly COVID-19 virus. According to latest figures from the Nigeria Center for Disease Control, the NCDC, the nation has recorded 47,290 positive cases of COVID-19 from 319,851 tests conducted since the inception of the pandemic in February. 33,609 patients have so far been discharged, with 956 fatalities. As of the last count, more than 12,000 individuals still have the virus, according to the NCDC. A breakdown of the latest figures show that 21 states and the FCT account for the 423 new cases. Lagos with 117, FCT follows with 40, Ondo 35, Rivers 28, Osun 24, Benue 21, Abia and Ogun 19 each, Ebonyi 18, Delta and Kwara 17 apiece, Kaduna 15, Anambra 14, Ekiti 11, Kano 9, Imo 6, Gombe 4, Oyo and Taraba 3 each, Bauchi, Edo and Nasarawa with 1. More stories now. Vulnerable persons from the 1,495 polling units of Nasarawa State are to receive food items for the second time to cushion the effect of hunger, which is posed by the coronavirus pandemic. Governor Abdullahi Sule, while flagging off the second phase of distribution of the food items donation, which was on behalf of a coalition against COVID-19, CACOVID, restated the government's commitment to cushion the effects of the virus.
These commodities will be shared across the 1,495 polling units in the state. It is important to note that these food items are to be shared to the poorest of the poor who have no source of income to cater for their daily needs. In this wise, salary earners, business owners, and other privileged people are exempted from participating in the sharing of these items. Accordingly, The steering committee of COVID-19 will ensure strict supervision and keen monitoring of the distribution process. I need to put on notice that the palliative committee at all levels will be held directly accountable for any abnormality in the distribution of these items. I therefore charge you to justify the confidence government reports in you by ensuring transparency and fairness in the distribution of these palliatives. Distinguished ladies and gentlemen, as you are aware, government remains committed in the fight against COVID-19 in Nasarawa State. In this vein, we will continue to enforce preventive measures with a view to protect our citizens from contracting the virus.
Well, as the debate over the conventional and online modes of education continues, some pupils in Calabar, Cross River State have just graduated after completing a 4-month online study. Speaking with Channels Television during the graduation ceremony, a school administrator spoke on the challenges of online studies, one of them being the possible exposure of children to different sites while having the online training. But for some parents, the online lesson is preferable as it strengthens the bond between parents and their children. Well, more opinions on the conventional and online modes of teaching and learning, especially during the present coronavirus pandemic. Well, proponents of the conventional classroom teaching say that this promotes the necessary bond between the teachers and their students, while those who support the online class believe that it has become the new normal the world over. The two sides, however, agree that necessary safety protocols must be strictly adhered to by students, whether at home or in schools, to reduce incidents of community spread of the pandemic. Over to Yobe State, where the government is distributing palliatives to teachers of private schools in the state who have spent 5 months without receiving salaries due to the lockdown. Governor Mai Mala Buni, represented by the Executive Secretary of State Emergency Management Agency, SEMA, believes that private schools are the unit of education worst hit by the pandemic, hence the need to be assisted. Also, 150 commercial call center vendors cut across the state have benefited from the gesture of the government, where each person got 10 kilograms of rice and other food items.
For like 3 months, private school operators were not able to receive salaries from their proprietors, from the school owners, of course, because of the COVID-19 lockdown. Some have received some palliative within their schools, but it is very clear that they are one of the key persons that really need support during this trying moment. They teach our children, they teach our orphans, they teach our young ones. So during the trying moments, His Excellency has also approved the inclusion of private school operators for the palliative distribution that is going on in the state.
The National Institute of Pharmaceutical Research and Development, NIPRD, is the agency saddled with the responsibility for research and development of drugs, vaccines, and more in a bid to improve access to quality healthcare in the country. But now more than ever before, NIPRD is a key component in winning this battle against COVID-19. The big question is, what have they been up to? Well, let's find out from Dr. Obi Adigwe, the Director General and CEO of NIPRD. He joins us from our Abuja studio. Well, good afternoon. Thank you for joining us. Well, naturally, the question on the lips of a lot of Nigerians will be, what has NIPRD been up to? How has NIPRD contributed to this COVID-19 battle, as it is called? Well, some may have heard about the hand sanitizers, COVID organics, which you actually coordinated. But how busy have you been, really?
Literally, we've been working round the clock, even before COVID even before COVID-19 hit Nigeria's shores. We had a project for the Ministry of Health that got us working through Christmas, and even before February 27th, when we had our first case, we already had a plan for how NIPRD will address the COVID-19 pandemic if it hits the shores. The hand sanitizer, as you mentioned, is one intervention that we brought to the fore very quickly. And the way we came about the hand sanitizers, the way we contextualized the formula, put together a robust database of local manufacturers, shared the formula, and led the awareness for engaging with local manufacturing, as well as ensuring that the quality of hand sanitizers that are available in the Nigerian market was the rate-limiting step to the reason why we saw those products in good quantity at good price, and we didn't see the empty shelves that we saw in places like Europe and in the Americas. But we've done much more than hand sanitizers. Like you mentioned, COVID Organics, we put forward the very first categorical research and scientific-led analysis of that particular product. And this was a charge by President Muhammadu Buhari, who said that even though we were going to engage with the product from Madagascar, our response to that particular product will be underpinned by the highest science available. And what NIPRD did was that he gave a categorical report to the Honorable Minister of Health, who went on to advise the PTF and the presidency. And incidentally, our report came out 2 weeks, the first report of its kind in the whole of Africa. Our report went viral in both English and French. We had people calling from Belgium, from France, from the UK to get updates. And 2 weeks after our report was released, Madagascar, it appeared, had their own crisis.
Right.
And that just goes to show you about the new approach that is being taken, about letting science, research, and development lead the way for how we make policy decisions.
Well, speaking of letting science, Dr. Adigwe, speaking of letting science lead the way, I mean, I'd like us to talk about the recent trends across the world, and in particular, Russia's vaccine. Is Nigeria willing to collaborate or work with Russia on the newly developed vaccine?
Well, that's a very good question, Kayode. As at this morning, the report my team presented showed that there were over 150 vaccine candidates, of which 19 are in clinical trials. I'm aware that Nigeria is engaging with a number of these candidates. The Gamaleya Institute in Moscow, like you rightly said, seems to have been the first past the post. I think they've started looking at having their authorization in a few weeks' time. But I share some of the concerns that were expressed on the United States legislature when Fauci made his presentation about there being transparency, about there being clear data regarding the safety and efficacy. And I'm sure that the team that has been put forward to assess who Nigeria is going to engage in terms of vaccines will also be using that criteria to ensure that whatever comes to Nigeria is of the highest quality and is safe for Nigerian citizens.
Okay, just one more thing. I recall the Vice President saying that Nigerians will not be left behind in this race, to get a vaccine. Have you received any directive on that? What is the direction, really?
Well, the truth of the matter is, I will not try to beat about the bush here. When you're looking at vaccines and access to vaccines, Africa has very limited capacity for vaccines R&D and manufacturing. A majority of the 150 people who have vaccines in various development stages are aggregated in Asia, in Europe, and in the Americas. And if they were going to bring a vaccine to Africa, the very first people they would engage with are people who have vaccine manufacturing capacity. In sub-Saharan Africa, that is South Africa and Senegal. The good news is that NIPRID, under the current leadership, has put forward a roadmap to ensuring that Nigeria now becomes a player in the vaccines manufacturing discussion. Using our medicine security argument a few years ago, we were able to articulate the need for Nigeria to step up its capacity in that area. And the Nigerian government under the current administration put forward close to 3-4 billion naira to partner with a local manufacturer to start vaccines manufacturing in Nigeria.
Well,
so
Dr. Adigwe,
whilst we may not be number one currently, we will definitely be in a position to get some of those products once they're available.
I will definitely keep tabs on your progress. But I'd like to thank you so much, Dr. Obi Adigwe, the DG and CEO of NIPRID.
You're welcome, Kayode, and it's my pleasure to update Nigerians as usual.
Thank you. Well, Kenya has indicated interest in Russia's vaccine as the WHO cautions that safety must not be compromised in the fight against the virus. That and more when we return. Please stay with us. You're welcome back. The Niger State government is following up on the safe reopening of schools with the distribution of safety kits for secondary school principals. Meanwhile, the state's COVID-19 confirmed positive cases still stand at 226, with 7 deaths recorded. Here is Emperor Simon with updates from Niger State.
Today marks the 4th day of school reopening in Niger State. The state government is responding to the needs of the schools that have reopened by distributing safety equipment to principals of secondary school. We were at the center of the distribution, the Niger State Education Tax Fund, where the equipment were presented to each of the principals that came.
The principals are the main stakeholders of the schools. So that is why you can see that the principals are here to make sure that every measure to prevent the spread of coronavirus is prevented in our schools. We are bringing in the students and then the teachers to make sure that nobody is affected. And I want to thank the state government for this gesture. You can see all these things are supplied for us to make sure that everybody is safe.
Before today, we held our meeting with the staff, informing them what to do and what to do as the students come in to the school. So they observe that the temperature taking, the hand wash and the rest of it. It was okay. And there was a massive turnout of the students.
The recipients of the items say they have been adequately briefed on how to use the equipment, and they hope to go back to their various schools and engage their teachers and the students.
In compliance with social distance, we have reduced the number of chairs and tables in the schools. We have equally spaced out the beds so that if, for example, we have 10 beds in a hostel, we've reduced the number of beds to be 5. And also we have sensitized the teachers as well as the principals on how to use some of these safety items.
Niger State currently has a total of 226 confirmed positive cases of COVID-19, with 7 deaths so far on the record. In terms of the spread of the virus, according to local government areas, 13 local governments have so far had cases of COVID-19, and Chanchiga local government area is leading with over 80 cases. Emperor Simon for COVID-19 update.
Well, Dr. Zainab Mahmood joins us this afternoon from St. Louis in the United States. She's a cardiology fellow at Washington University. Thank you for joining us on the program.
Thank you very much for having me.
Well, let me begin with some new developments where you are. I understand that Washington University has made some progress in the development of a vaccine, and that's a major buzzword now. So is there anything about that?
Yeah, well, as you know, there's been a kind of a race to getting a vaccine. There have been several countries, and even within the United States, there have been several universities and hospitals involved in vaccine development. So far, to my knowledge, there's been a couple in the US, one within the NIH, and there has been far advanced in kind of the development in what we call phase 3. Just to give a brief overview, there are different phases of vaccine trials, from development in mice models to phase 1 that tests safety in a couple individuals, to phase 2 that tested in hundreds of individuals, and then phase 3 that does a more widespread in thousands. So there are a couple of vaccine trials that are already in the thousands, in phase 3 trials at this point. One of them is in the NIH, and another one is one of them that's probably made the news a lot, one at the University of Oxford. I think yesterday there was news that there was vaccine approved in Russia. To my knowledge, that hasn't really reached phase 3 trials, so it could have been a premature approval.
So
But,
what?
like you said,
Right. So are you saying that for now we should proceed with caution regarding Russia's vaccine, which is called Sputnik V?
well, I think when you read even the approval, from what I read, it is an approval probably done to make the news, but really they have a kind of line there that says this approval is pending testing in widespread individuals, in thousands of individuals, to ensure that it's safe first before administration.
Just one more thing. SARS-CoV-2, which we call COVID-19, but for you is SARS-CoV-2, I understand it has major implications for the cardiovascular system. In fact, a considerable proportion of patients may develop cardiac injury in the context of COVID-19, which may lead to mortality. And the big question here is, how do we protect ourselves? I know, information keeps coming in, but how do we keep ourselves safe?
Absolutely. I think we're still learning every day. Currently here and where I work, I've seen a couple of late cases of people that had COVID back in March, April, that would come back with cardiomyopathy, meaning heart failure, several months after. So it's really hard to know exactly what to expect. We're learning every day, but I think the message still remains that prevention is key, and especially in places where we have limited medical care. So I think prevention will be key. Face masks, distance and physical distance, and like I like to say, prefer to say, is key.
Well, thank you so much, Dr. Zainab Mahmood, for your thoughts on the program.
Thank you so much for having me.
So as many countries continue to seek answers to the COVID-19 pandemic, Kenya is seeking a partnership with Russia after the country became the first to register a coronavirus vaccine. However, there is some skepticism over the speed of Moscow's work, and the WHO says it is discussing the process for possible WHO pre-qualification for the vaccine. Here's more on our global update.
Officials in Kenya say they are willing to engage with Russia over its COVID-19 vaccine. Chief Administrative Secretary Mercy Mwangangi says Kenya will plug in and work with Russia to ensure that the vaccine is safe before use. This is after Russia became the first country in the world to officially register its vaccine. But experts have raised concerns about the speed of Russia's work, suggesting that researchers might be cutting corners. Australia has seen its deadliest day of the pandemic, with 21 new deaths linked to COVID-19 reported on Wednesday. The new deaths were all recorded in the state of Victoria, where a state of disaster was declared earlier this month after a spike in new infections. The previous highest daily death toll was 19, recorded on Tuesday. A further 410 cases of coronavirus were also recorded by health authorities in Victoria. Meanwhile, France is among other European countries reporting recent spikes in infections, fueling fears of a larger outbreak. Prime Minister Jean Castex said that the COVID-19 situation in the country is deteriorating, with 2,000 new cases per day compared to 1,000 3 weeks ago.
We'll take a look at our website, channelstv.com, which has latest updates on the pandemic. All you need to do is log on and access the news in health, politics, business, sports, Africa, and any other area you desire to read on, all at your fingertips. Well, that's a COVID-19 update for this afternoon. Thank you for watching. I am Kayode Okikyolu. Please stay safe.